Merry Christmas and happy holidays. And again, thanks for listening. It's a busy time of the year. I hope you're soaking up family, enjoying the season, remembering what it's all about, and not just the hustle and bustle. And yes, Kim and I are still talking about retirement, what to do, what not to do. If you have questions, don't hesitate to give us a call at 612-504-8400 or havenfinancialgroup.com. Kim, you mentioned something on the last segment. You mentioned if this portfolio rebalancing, if this sounds appropriate, you don't know. But I like how you said maybe you don't have a portfolio. You know, that conversation sometimes can get complicated. And some listeners might be saying, wow, that sounds like it's only for those that have a lot, that, you know, have more complicated. And maybe you don't have anything, or maybe you have very little. Maybe you haven't really started a plan, or maybe you're younger and you're listening. We're very privileged every year to be helping clients, kids, never too early to start. So no matter what your circumstances, just getting started, small, medium, or large, cusp of retirement, maybe in your 80s, 90s, whatever that is, there's no situation that doesn't deserve time and time to look at what's going to happen, the good, the bad, and the ugly. Again, I just wanted to point that out.
Absolutely. And let's give everybody the number, 612-504-8400, if you're looking for a partner when it comes to your retirement strategy. In this part of the show, we wanted to talk a little bit about the unexpected relationship between health and happiness in retirement. But, I'm not really sure why we're calling it unexpected, because to me, Larry, everything in life is first and foremost about health. If you have your health, you've got so much more than what you can even, imagine. Because I think we've all known individuals who don't have their health, and then it really doesn't matter how much money you have in the bank or what kind of plan you have for retirement, because you're just dealing with health issues. So I can certainly understand where health and happiness, and especially in retirement, they go hand in hand.
For sure. I mean, healthcare planning isn't just about, the physical health and the financial costs. Now, when I say that, I'm careful because we help a lot of people in the healthcare, whether it be bridging the gap for healthcare if you're not to Medicare, on the open market, Minnesota Care, MNsure, private market. Because let's face it, healthcare is a major expense in retirement. We just help hundreds of people in an annual enrollment, Isabella and Glenn. And we help people throughout the year. Help people address their health care, get the best plan possible for the cost that suits their situation. But again, it's much more than that. Health is a game changer. I see it. My mom's a 2-time cancer survivor, swims with the ladies in Wilmer 5 days a week. She's tough. But those 2 years, guess what? It changed her years.
Yes.
She's doing great, but we see it all the time. And it's unfortunate. I see people that all of a sudden lose family members, spouses, friends. So it's important that you got to have good balance. Mm-hmm. And, what does that mean? Because for all these years you work, maybe you went to the health club, but your lifestyle was what it is. It is what it was and whatever. And now you're retired. You have more time on your hands. What do you do? There's a good health is a stronger predictor of retirement satisfaction than wealth goals itself. And I completely agree with that. Chronic illness, we do help a lot of people in long-term care. And right away, if somebody's listening, long-term care, I know I don't like to talk about it either. That's why I like Glenn and Isabella talk about it. Just because it sneaks up on us, and anybody listening is taking care of mom or dad or a family member that's been in the nursing home or home health care or hospice. It's a really tough thing. And if you're young or whatever age you're listening, and you haven't looked at the options for long-term care, 70% of us are going to need some sort of long-term care coverage. 70%. Yet very few have anything in place. Yes, your kids will take care of you. I'm not sure that is going to work out so good. I wish you the best. But if it doesn't, then what? Long-term care or healthcare or nursing home can decimate an estate quickly. That is not fear and scare tactics. It's reality. You should get educated of the options that are out there that are far more in depth than just the traditional long-term care. what do you do in retirement? We all need a purpose. Does that mean, getting a part-time job, doing something fun? And, maybe your social aspect of working, that was your social time. And now you're not working. Now, how do you occupy that time?
Right.
These are the things people have to figure out. And some do it quickly. Some it takes longer. And unfortunately, some people never figure it out.
Mm-hmm. Yeah, the social aspect, I think, of and staying connected when you're in retirement is so important for mental health as well as physical health.
For sure. And all the things that they preach to us that are important, staying active, right. Getting exercise, eating properly. My wife and I've been trying to do that, even though we have a very busy lifestyle. And we've actually in the last year done a lot better at that. However, I do point out that I just last weekend went to the grocery store, and I haven't been to the grocery store in a very long time. And I'll tell you, buying healthy is really expensive.
That's right.
Oh, my goodness sakes. Those berries and other things that are out there, I'm like, are you kidding me? Yeah. I've just been kind of naive to it all, but yes, it's important. Of course, it's important. Nutrition, community engagement. I see a lot of our clients that have worked hard, they retire. I see a lot of smiles on their face when I see the enjoyment of them donating their time, giving back, working at the hospital, whether it's just giving directions or information. I have one client that, plays the piano. She's a great pianist, and she plays the piano at local nursing homes and puts people smiles on their faces. So I do see a lot of excitement when it comes to this is what I want to do. And when people do it, wow, they're really, really happy. You just got to find your niche in retirement.
Sure. Absolutely. So let's talk for just a second here about how you approach the issue of healthcare with your clients, because I think a lot of people, like, for example, long-term care, I think a lot of people are very afraid of that because of the expense. How can people take care of their long-term care and at the same time not go bankrupt?
Well, look at all the options. It's not going to be feasible for everybody. Nothing is for everybody. Mm-hmm. However, for those that have potentially saved for retirement, and maybe they have some adequate resources, different buckets of monies, if you will, right away people think of traditional long-term care, where maybe 5, 10, 15 years ago, somebody tried to sell you one. It was the Cadillac policy. It covered everything, and God forbid, could anybody afford it? Absolutely not. It scared you to death, and therefore put a bad taste in your mouth, and not going to do this and not going to talk about it. Mm-hmm. Well, those traditional long-term care policies, first of all, a lot of those companies aren't even around anymore. There's a lot of miscalculation in the industry. A lot of them aren't even here. A lot of them changed. And it really led to a variety of other types. Now, Glenn is better at educating people in this. We have access at Haven Financial Group to all the companies. Hybrid long-term care. Maybe take an X amount of dollars, put it in this bucket. Is it maybe a 2 or 3 times multiplier? And if you don't use it, it stays with the estate. It's an insurance policy product. It makes a lot of sense. Just this past week, I had 2 couples that never even thought they would entertain it, but they go, wow, that isn't what we thought, because back when we looked at it, this wasn't even out there. Sometimes people use annuities that have long-term care riders because maybe they can't, with their health, they're not able to qualify for something. A lot of those, it's part of the annuity product, and it can offer some additional income. All we say is, comes down to the education piece. Come on in, set a time with Glenn. He'll go thoroughly through it. At the end of the day, you have more information to chew on to figure out, yep, this is good for us, that we can do this. It makes sense. Or if nothing else, cross it off the list. It doesn't make sense. But at least you didn't bury your head in the sand and not look at all the options. Absolutely.
Give Haven Financial Group a call so that you can discuss some of these options when it comes to making sure that your retirement is a healthy one. 612-504-8400. That's 612-504-8400. You can also check out their website. It's havenfinancialgroup.com.